Good afternoon, everyone, and thank you for joining us on this live stream to help answer some questions about the spread of the COVID-19 virus in our mountain towns and our communities. My name is David Krause. I'm the editor of the Aspen Times and the lead of the editor group for Swift Communications, which has publications in Colorado, Utah, and California. We will be hosting this live stream for about the next 45 minutes, and we are pleased to be joined by Dr. Glen Mays, who is a professor and chair at the Colorado School of Public Health. The editors of our papers have a set of common questions that we've put together to ask Dr. Mays, and we invite you to send your questions on this feed as well, and we'll get to those at about 2:30 for the last part of our 45-minute session. If you are joining us via Zoom, I ask that you hit your mute button now so that we can have clear audio throughout the presentation. Look health. I'd like to quickly introduce the editors in each of the communities that we serve. In Colorado, we have Lisa Schlichtman at the Steamboat Pilot in Today. We have Nate Peterson at the Vail Daily, Nicole Miller at the Summit Daily News, Peter Bowman at the Glenwood Springs Post-Independent, Eli Pace at Sky High News, which serves Grand County, Josh Carney at the Craig Press, and Kyle Mills at the Rifle Citizen Telegram. Working to the west, we have Bubba Brown at the Park Record in Park City, Utah. And in California, we have Brian Hamilton at the Sierra Sun and Grass Valley Union, and Bill Rozak at the Tahoe Tribune. Also, we are working out on the plains with our agricultural publications, including editors Carrie Statham and Mariah Wormer at the Tri-State Livestock News and Farm Rancher Exchange. Just so our viewers know, after this live stream, we will post this Q&A to all of our websites and social media. And with that, I'd like to turn over our conversation to Kelly Geary Agnew, who is our marketing strategist for Swift Communications and has been working with our editors on this project. And she'll do the next 30 minutes of Q&A with Dr. Mays. So Kelly and Dr. Mays, please take it away.
Great. Thank you, David. All right, so real quick, I want to ask our guest and speaker, Glen Mays with the Colorado School of Public Health, to introduce himself and just tell us a little bit about his expertise and why he's talking to us about the new coronavirus and COVID-19 today.
Fantastic. Thank you so much for the chance to join you. Again, I'm Glen Mays, professor and chair of the Department of Health Systems Management and Policy in the Colorado School of Public Health, based here at the University of Colorado on the Anschutz Medical Campus. I've spent about 2 decades in the field of public health research and health systems research specifically. And my area of work really studies how health systems and public health systems can best prepare for and respond to emerging health threats like the one that we're all dealing with now, coronavirus, as well as other types of hazards that emerge that can affect health status for large groups of people. So very glad to be with you here today.
All right, great. Thanks, Glenn. So as Dave mentioned, we've got a couple of questions that we've put together for common things that we've been hearing across all the markets that we work in. So we're going to run through those before we get to audience submitted questions. All right, so to start us off, how is the new coronavirus different from the flu? I think you hear a lot about, especially as it was first emerging, it's similar to the flu. Why do we need to be, more worried about this than we are about anything else, et cetera? But how's it different in symptoms, how it spreads, how contagious it is?
Yeah, so this is a viral infection, the coronavirus, and so is the flu. So there are a number of commonalities, particularly in symptoms. Coronavirus, kind of the signature symptoms are fever, dry cough, shortness of breath. You can also have some muscle pain and fatigue. And many of those symptoms are also encountered with influenza infection. I would say the shortness of breath is probably the one one is more of a distinguishing factor that's related to coronavirus, and you're less likely to see that in influenza, particularly in the early stages of an influenza infection. So shortness of breath is one symptom that really more distinguishes coronavirus from flu. In terms of how infectious this coronavirus is compared to the regular flu, it does appear to be significantly more infectious or more contagious. The reproduction rate is one of the measures that we use to measure level of contagiousness, how quickly that it spreads. And again, we're still learning about coronavirus, but our best evidence today suggests the reproduction rate for coronavirus is about 2.2, meaning for every person who has the infection, they're on average, they are likely to spread it to about more than 2 additional people. For regular seasonal flu, that reproduction rate is more like 1.3. So coronavirus has a much higher reproduction rate, almost twice as high as the flu. And that's one factor that makes this more concerning, is that it's spreading more rapidly across the population. In terms of its overall severity, we also talk a lot about the mortality rate. And it's true, lots of people die every year from seasonal influenza. But the mortality rate from coronavirus also appears to be significantly higher than the mortality rate that we see from seasonal flu. An order of magnitude larger, higher mortality for coronavirus. Typical seasonal flu, only about 0.1% of people who are infected with seasonal flu die from it. With coronavirus, again, we still have some uncertainty around that estimate, but it's somewhere between 1% and 2% are our best estimates of the mortality rate from coronavirus. So it's much more deadly and much more contagious.
Good to know. All right, our next question, how is it transmitted? And one thing that I think we're wondering about, it seems like there's different information, how long it can live on surfaces. You talked about transmission from person to person. So how's it transmitted? How long does it live? And then what's the best way to keep it from lasting too long on those surfaces and other materials?
Sure, yeah. And again, the science on this has continued to evolve over time. This is a disease that we didn't know existed until just a few months ago. But the major route of transmission is definitely from droplets that are spread person to person, from the breath, from coughing or sneezing, or just from talking in close quarters. Droplets that are transmitted from person to person. It does not appear that the coronavirus that simply that breathing the air that has been breathed by people with this condition, that aerosol, the ability of the virus to be aerosoled, that does not appear to be a major risk for the coronavirus. But it is the major route is droplet transmission, being in close proximity to someone who may be talking or sneezing or coughing. Now, it's also true those droplets can land on surfaces and then be exchanged person to person that way, or through handshakes, for example. That's why we're trying to discourage people from handshaking. And so it's also possible to transmit it from droplets that land on surfaces or on clothing, doorknobs, that kind of thing. The research suggests that the virus can remain alive on surfaces like that from anywhere from a few hours to potentially a day or two, depending on the surface and on things like temperature and the other conditions. And so that's why it's important, to exercise strong, cleaning strategies, particularly in public areas, in schools, doorknobs, services, tables. Those kinds of things where where people are potentially could be leaving these infectious agents. For washing clothing and cleaning services, for again soap and water as the best way for cleaning your hands and those kinds of things. For washing clothing, the recommendation is just using traditional detergent, washing them on as high a temperature as your clothing can stand, and then drying clothing thoroughly. So I'm someone who usually doesn't use the dryer for my clothes, but I'm using the dryer now because that can certainly help to eliminate the virus. For surfaces, cleaning agents that include, that have alcohol or bleach are the ones that are recommended by CDC now. Alcohol content of at least 70%. Bleach using the standard ratio of about 1/3 of a cup to every gallon of water. Those strategies, or other cleaning agents that are designed, for disinfecting. Those should all work for cleaning surfaces, doorknobs, tables, and those kind of things.
Great, good to know. Good to know about high temperature. I hadn't thought of that. What should I do if I think I might be infected? If I'm worried, what are next steps I should take? When should I contact my doctor? How long should I wait? That kind of thing.
Yeah, the important thing to recognize about the coronavirus is that for most people who are affected are not going to develop serious complications that require any medical intervention. So we have to recognize that for most of us who are healthy, a lot of us are going to be at some point infected by this virus, and most of us that are infected are not going to require medical intervention. So if you have mild symptoms that would not otherwise trigger you to visit a hospital or visit your physician, there's not a need to contact the doctor. In fact, one of our biggest concerns with this outbreak is that with this virus is that we have the potential for our healthcare systems to be overwhelmed with a surge in demand. And so for people who are experiencing the regular symptoms of a cold, which are parallel to the symptoms of a coronavirus, if you just have a mild fever, a dry cough, but it's something that you can manage on your own with traditional, with over-the-counter medications, we encourage you to just practice, the safe strategies of isolating yourself from other people so you're not spreading the disease. Really, the recommendation is to contact your doctor if your symptoms are getting worse and are really starting to cause problems for you. In particular, shortness of breath. If you're starting to have trouble breathing and shortness of breath is interfering with your ability to care for yourself, that's the time to call your doctor.
Great, good to know. Very clear there. All right, moving along. This is coming up a lot, I think, for us, especially because we're all newspapers. Why is only limited information released about people who've tested positive? There may be some privacy concerns there that need to be considered. And if people are concerned that they maybe have come into contact with someone without knowing it, what steps would we recommend they take?
Yeah, this is a very important question. And the answer here, there are both legal and, more importantly, public health reasons why information is protected and maintained privately for individuals who have tested positive for coronavirus. On the legal front, we have a law that's been on the books since the early 1990s, the HIPAA, Health Information Privacy and Protection Act, that guarantees that personal information about a person's health condition and medical intervention is required by law to be held, to that information is required to be protected and not released. And all the medical care institutions and public health agencies are required to keep that information private and to only disclose it to other people who need the information to help respond to or treat that condition. The public health reason for keeping this information private is we do not want to discourage individuals from coming forward who potentially have the condition and need to be tested. And it's very important that the public is not, we don't create disincentives for them from coming forward and being tested and for this condition. So that is those two reasons are why legally and from a public health standpoint we have to protect the privacy and confidentiality about individuals who test positive for this condition. Now, the public health community, when they have this information about individuals who test positive, that information is immediately transmitted to state and local public health authorities, and they are the agencies that use the information to do what's called contact tracing. They do a very careful job of tracing back for every positive case. They trace back all of the individuals who have come in contact with that individual, that positive case, during the potential window in which they were infected. And as well as they identify all the places where positive cases have been, all the people who may have come in contact with that person, and they do the checking and notification, and then supporting the isolation of those individuals who may have been infected by the positive cases. It's a well developed public health strategy, this contact tracing, and we've got to rely on our public health officials to do that work. And again, these privacy protections are part and parcel of what makes that strategy work so well. So if you are concerned about where a patient was and when, the best thing to do is to, again, listen to the information that's being released by your local public health agency is really the best source of information about that information. That if there are settings where they are concerned about where there may have been exposures and contamination, your local public health agency will be the one to provide that, have that information, and share that information.
Great, good to know. All right, this is a new term that we learned that we have never heard of before. So talk a little bit about what's the science behind social distancing and why the radius for social distancing is 6 feet.
Yeah, so this is another well-established public health practice based in strong science that applies to many types of infectious diseases, viral infectious diseases like what we're dealing with the coronavirus. It is based on a lot of strong research, including research that has been done over the last few months, specifically around this novel coronavirus, as well as other infectious agents that are transmitted primarily through droplets, which is the case for this coronavirus, as well as for influenza and other viral infections. And the range of 6 feet is the range, as the maximum range that droplets are likely to travel whether they come out of the mouth or the nose or other places before gravity pulls them to the ground. Droplets cannot be suspended in air indefinitely. They are larger particles. They are pulled to the ground eventually, and 6 feet is what the research shows us is kind of that maximum range. So if you're outside of 6 feet from another person, even if that person sneezes or coughs or talks loudly at you, you're unlikely to get to be exposed through droplets, which is again the primary mode of transmission for this virus.
Right, makes sense. So we know droplets can't travel that radius.
Thanks to gravity, yes.
Right, exactly. So this is kind of a question that I think maybe has a broad answer, but should people continue their daily routine? If they're healthy, they don't have a fever, they don't have a cough, is there a chance that they are carrying it without symptoms? And if they're not carrying it, is it okay to kind of continue around daily routines, or should people try to change their behavior to stem the?
Okay, everybody, we are back after our quick power outage in Denver at Dr. Mays' house. So sorry about that. We're going to keep going with the questions, and Kelly and Dr. Mays will keep going on that, and then we will get to some of the viewer questions. So Kelly, why don't you and the doctor keep going on where we were when we lost power?
Sure. So I think the question that we were working on was whether or not people should continue their daily routine. If they're not showing any symptoms, is it safe to go about your day-to-day, or should you maybe avoid doing those things? And maybe that depends on how severe the outbreak is in your area and where you're located.
Yeah, so this is an important question. It's one, the answer really has evolved pretty considerably over the last couple of weeks for us here in the U.S. Um, the bottom line is that we know that we're seeing pretty widespread evidence of community transmission of this virus in most parts of the country now. And so that's the reason for these stronger recommendations and policies being put in place around social distancing, around minimizing our interaction with other people in the community. In general, I would say, unless you've got a job that's kind of the critical position in your community, a healthcare worker, another member of essential personnel. We really should try to, in our daily routines, to limit interaction with other people that could create an opportunity for disease transmission. So we all have to continue with certain activities around grocery shopping and getting food and making sure we've got the other essentials taken care of. But while we're doing those activities in our daily routines, keeping in mind, social distancing where we can, the 6-foot rule, and making sure we're being real careful with hand washing and other things.
So that's a good lead in kind of to our next question. You talked a little bit about it. There are still those times when you're going to have to go outside if you've got to get groceries or whatever that is. What should I keep in mind if I've got to go out? How do I keep myself and others safe?
Yeah, the main thing is try to avoid being in close proximity to large groups of people. Otherwise, it's safe to go outside and in terms of getting out for your daily activities, getting out for exercise, and other kinds of activities. Just trying to minimize close proximity to other people, in particular larger groups of people. The CDC recommendation now is try to avoid being in groups of 10 or more. Which is a pretty small group, but that's the recommendation now, and that's the main way to keep yourself safe, is trying to again avoid situations where you're in close proximity to other people.
All right, great. So this is an interesting one, and we want to just get your take on this as kind of an expert in the public health field. What are your thoughts on when we might see the peak and when we might see things start to return to normal?
Yeah, and this is another question where the science is evolving on this, and we're mostly the answers to this is generated largely by looking at the trajectory that has happened in other countries, and looking at what's happened now in China, South Korea, and parts of Europe. The thought is that we are at least looking at probably 8 to 12 weeks. Before we might see the beneficial effects of these social distancing strategies kick in and begin to see the downward slope of this epidemiology curve for this disease. If we look at China, they're just now announcing no new cases after a solid 2 months of implementing very strong control and mitigation strategies. And so likely we're also looking at, again, an 8 to 12 week period, 2 to 3 months, before we might be able to relax these kind of strategies.
So basically, people can kind of expect, social distancing and all these things that we've been talking about. They want to keep those in place for at least that period of time, so that we start to see those declines.
That is my expectation, is that we're going to see these recommendations to stay in place for at least an 8 week period, until we can see evidence of transmission slowing sharply.
All right, great. So that's a lot of good information. I think that's really helpful to us and to our readers. We gathered a lot of questions on our websites and on our Facebook Live feeds. So Dave, you got some of those questions pulled up that you want to ask?
Yeah, thank you, Kelly, and thanks again, Dr. Mays. We've been getting a lot of questions for sure from Facebook and from our live feed. So we'll roll through those real quick, Doctor, and maybe if you have quick answers. I think I've vetted out most of them, so we haven't got too much overlap, but some really good ones. So let's start with this. This is one that people in the mountain towns have been asking. Does the snow and cold air kill the virus? And alternatively, will the warming temperatures help?
Yeah, so there's still uncertainty around this with regard to how temperature and climate affects this particular virus. We don't have a lot of experience with it yet. I don't think there's a lot of evidence that the cold climates are likely to slow the spread of this disease, but a lot of viruses like this one are particularly sensitive to hot and dry conditions, and so there is some expectation that perhaps we could see a slowing of transmission when we get to warmer temperatures, particularly in higher, drier climates like we are in many mountain areas.
Great. Here's one from Finn. Once you're infected, are you immune going forward?
Most likely, yes. The infection should generate some immunity as our body recognizes this and has generated antibodies for it. If this virus is like a lot of the other viruses that we studied and known, there should be natural immunity built up in our populations as a result of being exposed to it.
Great. And kind of along those lines, this is from CD. Do you have any insight about how people will be able to tell if they were infected and now recovered?
Yeah, ultimately, we will have antibody-based tests for this virus, like we've developed for others, and those tests are underway. And that kind of test, looking for antibodies in the body, will tell us whether someone's ever been exposed and their immune system has then reacted and adapted to that. And so likely we will have those kind of tests sometime over the next 12 to 18 months and be able to get a much better handle on who's been exposed and who's likely to have built up resistance now.
This one is from Amanda. I live with an at-risk person. I have no symptoms. Should I not stay at home with her until this is over? So how do you feel interaction with at-risk people, especially if you live with them?
Yeah, it is best practice to try to limit interaction with at-risk people in your household. Having separate bedrooms, separate bathroom facilities if you can, and just practicing being vigilant on cleaning surfaces that you might share. Those are very important, along with yourself. If you're living with someone with an at-risk person, just being extra cautious about trying to limit your interaction with others outside who could be transmitting the virus.
This is from Nina. How are those in contact with our first community transmission case being advised to behave with work, gloves, mask, disclosure to the employer?
Yeah, so people who are documented to have been in contact with confirmed cases, there are very established protocols for isolation for those individuals for a 14-week period to see if any symptoms develop, and those contacts are advised to follow fairly strict self-isolation procedures, including limiting their limiting themselves to staying at home over that 14-day period. And then limiting their interaction with anyone else over that period, including through the workplace.
Here are a couple kind of related to lung capacity and when it gets down into your chest. I know when I was sick in February, I was really glad that it stayed up in my head and my throat, and I was out for almost 4 days, which is one of the sickest I've been, but it never got into my chest. And I am someone who has asthma, so I was really glad about that. But a couple of questions we got. Can you address people with asthma concerns? And then also, can you confirm that smokers, particularly vapors, are at a much higher risk of infection than serious illness?
Yeah, certainly. So this virus, creates the most trouble in the lungs. It attacks the lungs. The major receptors are in the lungs, and that's what creates the complications from this infection. Is lung infection and problems. And so certainly people with pre-existing lung and breathing conditions, including asthma, are at higher risk. Not at high risk of contracting the infection, but at high risk of developing complications from the infection that could cause health problems. So those people need to be very attuned to those issues, and so it's, I mean, that it's very very important. On the issue of the smokers or another and other people, vapors as well. Those are behaviors, certainly for smoking, got very strong evidence that significantly elevates the risk of complications from this condition. So best thing you can do is to try to quit now. Lungs can recover, start to show important signs of recovery within 24 hours of stopping smoking. Vaping, the same issue, has the potential to impede lung function, and therefore can make you at high risk for complications.
Awesome. A couple more. Here's another one on the lung from someone in Park City. Can we tell shortness of breath from altitude versus shortness of breath from coronavirus? We are at 8,000 feet, and if we think we could be positive, where should we go?
Yeah, that is a complicating factor in understanding this condition, distinguishing the symptom of this condition at higher altitude. The shortness of breath, particularly for people who are not adjusted to altitude, who have recently come to altitude, being able to distinguish shortness of breath because of the altitude versus shortness of breath as a possible symptom of this infection, that can be difficult to distinguish. The best advice, if you're experiencing significant difficulty in breathing, that's the time to seek medical advice. That is a legitimate reason to reach out, to call your physician and get checked out.
All right, let's go with two more, doctor, if we can, and then we'll get you back to your work that you're doing. Why is it taking 5 to 10 days and maybe longer to get test results back when so few people are allowed to test? And another question that we got quite a few on the testing, so I'm kind of narrowing it down. So why is it taking so long, and why do we have so few tests right now?
Yeah, this has been the major stumbling block for our response to this epidemic in the U.S. We were slow to produce testing strategies. We've been slow in disseminating those testing capabilities out to labs across the country, both public health labs as well as private labs. That bottleneck is supposed to be getting better, but we're still far from an ideal situation. Still have limited testing capabilities in many areas, particularly in areas that are more distant from, like the public health laboratories that often are in our state capitals where our state health departments are located. So what accounts for delay? Even once you capture samples, those have got to be transported out to the public health lab or another commercial lab that can do the test. That can take a day or two. Then you've got to have the workforce to do the test, to run the test, interpret the results. And depending on the staffing levels in these labs, that's what causes the 2 to 3 to even 5 day delay sometimes in getting test results back. We hope that that's going to continue to get better as labs step up and as testing becomes more widely available, but it's still a big problem for us here in the U.S.
All right, great. And then last one, and this is starting to really pop up in the Colorado towns, but talking about with the closures of restaurants and bars to only takeout service. Chris in Glenwood, I'm seeing a lot of requests to get takeout from restaurants to help our service industry. I have been fearful to do that, as I don't know if that is really safe to do so. What's your opinion on that? And would that help lower? Yeah, what's your opinion on that?
In general, I think this can be a safe strategy. We have evidence on this as well. It's been played out. These takeout strategies have had to be used in China and in South Korea and in Europe that have other major outbreaks. Just being safe about it. When you have food delivered, it's best if the deliverer can drop the food off at your door. You can pay online. You don't have to share a PIN or sign for anything or exchange a credit card. That will limit transmission. And then just being real careful as you unpack food, put it on your plates. Just wash your hands after you do that, before you eat. That's going to cut any risk of any transmission from, viruses being on the surface. So you can definitely be safe ways of continuing to enjoy takeout food from our great restaurants.
Great. Awesome. Well, that was really great. Despite the fact that you lost power, I'm glad we can see you again, Dr. Mays. I want to really thank everybody today for joining us. This will live on our Facebook feeds and as well as on all our websites. Our thanks again to Dr. Mays for taking time out of his busy schedule to give us some time and talk about this. I think is really helpful. Really a lot of thanks to Kelly for putting this together and working with all our editors across our Swift properties. Reminder that this video will be available and we'll keep it out there. Hopefully we can do something like this again, either with Dr. Mays or another one of our great healthcare people in Colorado. Again, I'm David Krause from the Aspen Times, along with Kelly Geary-Agnew from Swift Communications. We thank you for joining us today. Thanks again to Dr. Mays. So please, everybody stay safe and stay healthy.
Thanks.
Thank you.
Thank you so much.